Is sponsored by NAIC, National Association of Insurance Commissioners. During the height of the pandemic, the government declared a health care emergency that is set to expire soon. Joining us today is Dean Cameron, president of the National Association of Insurance Commissioners, here to discuss the big impact this will have on health insurance. Welcome, Dean. Thanks for joining the show today.
Thank you, Carrie. Thanks for having me.
Oh, we're so happy to have you. Now, why is this issue so important right now?
So the public health emergency was set to expire this week. It got extended to January 11th, but it's still really important that consumers during the open enrollment period review their situation and make plans for 2023.
Okay, and what effect would the emergency ending in January have on health insurance coverage?
So public health emergency gave additional benefits, additional subsidy. Perhaps people qualified for Medicaid because they were in the pandemic. And when it expires, those individuals will lose coverage, or they will lose their subsidy, or they'll have some really tough choices to make sort of after the fact.
Okay, this is good information to know. How can consumers protect themselves against misleading advertising around Medicare and Medicaid and ensure they're getting good coverage?
So open enrollment period has just started for those that are seniors, 65 and older, and will start in November 1st for those that are under 65. And there's lots of advertising, misleading information. If it sounds too good to be true, it probably is. So the first way you can protect yourself is deal with a local agent. Deal with someone you can trust, that you have confidence in, and that you can reach out. If you don't have access to a local agent, go to your local or your state Department of Insurance. I know the commissioner there in Utah. He's a good man, and they have a good department that will help consumers make sure that they're asking the right questions and that they're having the right assistance. There also is usually a state health insurance program or a health assistance program or senior program that's available for consumers.
Well, and with open enrollment around the corner, what questions should consumers ask when they're considering purchasing a healthcare plan?
Yeah, so that's a really great question. The first thing I'm going to look at is what my prescription drugs are. And perhaps they've changed since I bought last year, because these are annual open enrollments. You have the opportunity each year to review your prescription drugs. Make sure your plan's covering them the same way they did in the past. You can look at who your doctor is, who your hospital is that you want to go to. Make sure that they're still in network. Whether you're changing plans or not, you should review it. Then you can also look at what other options are available, working with your local agent. You can look at the cost, not only the cost of the premium, but the cost of your deductible, your copay, your co-insurance, and make sure that it's the plan that best suits you. Sometimes the cheapest plan isn't the best plan.
Okay, those are good tips. And what can consumers do if they receive a surprise balance on their healthcare bill?
So this is also a new recent phenomenon and really a great question that you're asking. So in the past, if you went to a hospital or emergency room, you could get a surprise balance bill. Under federal law, that can't happen anymore. So if you get a surprise balance bill, you get a bill that's bigger than you thought it should be, go back to your provider and ask them to fix it. If they can't fix it, come to your state Department of Insurance, the Utah Department of Insurance. And if you need an address to the Department of Insurance, go to NAIC.org.
Thank you so much for all this information. We really appreciate you, Dean. Have a wonderful day.
Thanks so much. Take care.